Thank you all for attending this session. As you've heard, my name is Cindy Moore, and I'm a clinical psychologist from Mass General Hospital, where I've spent the last 17 years working with the Parenting at a Challenging Time, or PACT program. The PACT program came out of the knowledge that for so many parents, really one of the most difficult parts of living with cancer is dealing with its impact on children. So our mission is to address the parenting concerns of adults treated in our Mass General Hospital Cancer Center. And we work with parents to support the emotional health and resilience of their children. The approach we take is to offer parenting consultations to patients who are parents or grandparents of infants up through emerging adult children. I know that you are here today with a range of circumstances. Some of you have a fairly new diagnosis, and some of you have been living with MBC for a long time. You have different symptoms and side effects, and I know that you probably have different expectations about how you'll be doing 6 months from now, a year from now, or 10 years from now. Part of what I really appreciate about my work with the PACT program is being able to tailor conversations that I have to an individual's specific situation and comfort level. So preparing a one-size-fits-all talk for today was really challenging. In the end, I decided it would probably be helpful for me to model for you what I will encourage you to model for your children, being open and honest about even the hard parts and trying to find ways to move through it together. So I hope to talk about some of the challenges you may be facing in a way that feels helpful and manageable to all of you. But I want to acknowledge that parts of this talk might be a bit evocative or hard to hear and think about. So if you decide at any point that this talk just isn't your cup of tea today, I hope that first you'll find a way to do something really nice for yourself. And then later, perhaps come back and get your copy of the slides. There's one near the end that includes some resources that might be helpful as you move forward. So as you all, of course, know, MBC is a life-altering illness that's also potentially a life-shortening illness. And so I am so impressed with really the Olympic levels of flexibility, balance, and strength that I witness in parents through the course of living with MBC. Some of the challenges I hear about include the fact that treatment and symptoms often change. So just as you're getting used to a new normal, that new normal changes again. Another challenge is knowing that despite doing everything right, the illness can get worse with time. And so finding a way to balance living fully in the moment with planning for the future isn't always easy. And when you are thinking about the future, it can really feel like mental gymnastics to try to sort of hope for the best and plan also for the worst. Sometimes we ourselves or loved ones really emphasize the importance of positive thinking, of hoping for the best in a way that can make it pretty difficult to also leave room for planning for the worst. And our team sometimes talks about that as the tyranny of positive thinking. On the other hand, some parents are such good planners or just worry that no one else is, that they can end up focusing on planning so much that it can feel to children that they're getting kind of rushed through childhood. So parents with metastatic illness might find that they're working very hard to draw on their strengths as parents, but also have to face their own or their partner's parenting weaknesses, which of course we all have. So all of these challenges can sometimes make parenting feel like very hard work with high stakes. So what are those stakes? For nearly every parent, it's to make sure that their children thrive now and in the future. And that idea of thriving, even in the face of difficult circumstances, is what psychologists mean by resilience, a word that we're hearing a lot these days. The Harvard Center on the Developing Child developed this illustration of resilience, which I really like, as sort of the balancing of a scale. So protective experiences and coping skills on one side counterbalance and hopefully outweigh the impact of adversity on the other side of the scale. Resilience means that your child's health and development tip toward the positive outcomes, even when there's a heavy load of factors stacked on the negative outcome side. Excuse me. So for children coping with a parent who has cancer, what would positive outcomes look like? Because we know that most children will feel distressed about a parent's illness. But what we want to see is children continuing to meet developmental milestones in terms of their emotional, cognitive, and social development. So they're learning how to name, tolerate, and manage strong feelings. They're making progress with academics. They're feeling connected to parents. They're learning how to get along with other kids, how to be good friends. Those are all the kinds of positive outcomes that we want to tip the scale towards. So I'm going to spend the rest of my time focusing on some of the factors we can add to the scale to tip it toward those best outcomes for children. But I'm going to give away the punchline now. The most important factor for growing resilience in children is having at least one stable and committed relationship with a supportive parent or caregiving adult. And a key aspect of that relationship is the idea of warm parenting, suggested by the heart in the box on the right there. Warm meaning, being interested in children's experiences and affectionate and loving. Other things that can tip the scale in the right direction are the 4 C's of good communication, family cohesion, the child's having a sense of control, and having a variety of connections with people in and outside of the family, religious groups, and other supportive organizations. On the other side of the scale, an important risk factor for children's worst adjustment to parental illness is untreated and ongoing depression or anxiety in a parent or caregiver. So I really want to emphasize here that taking the time to take care of yourselves in ways that protect your mood and mental health is not selfish. It's really a very important way of also caring for your children. So communication is the C that comes up most often in my PACT consults. I imagine that many of you may have struggled to figure out how to talk with your children about cancer over time. It's really common for parents to have questions about whether to share the word cancer, whether to talk about, how treatments are working with their children. Parents usually want to say enough, but not too much, and it can feel really like a tricky balance beam act. So on the one side, you may understandably want very much to spare your children from feeling distressed, and you may feel that not talking is the best way to do this. Some parents are very concerned that sharing certain information could cause their children to fall behind, usually in school or in sports, but sometimes it's more a worry that a child won't launch as they hoped. For example, won't attend college or take advantage of other opportunities. And you might worry about open communication because it could lead to questions that might be challenging or even painful to answer, and especially questions about prognosis. So I want to acknowledge that talking about metastatic cancer is particularly challenging, partly because there is more uncertainty in the overall picture. And so it's harder to be confident about things going the way everyone is hoping they will. Even with all of those worries you may have, I still encourage you to find ways to talk honestly with your children for a few reasons. First, many children are incredibly observant and perceptive when it comes to things that might threaten their security. We're all sort of wired that way. It's like children have, sort of invisible antennae that go up in response to even small changes in family routines or just the emotional climate at home. And it's really not easy to completely cover the cancer trail. You might get phone calls when you're driving, so kids are hearing them, or they might see written material left out on a table by accident, or notice physical symptoms or treatment side effects. And it's human nature, even for small humans, to try to make sense of what we perceive. When children get the signal that adults don't want to talk to them, they might create their own explanations, and those explanations might be incorrect. I've heard about children whose detective skills led them to the conclusion that their parents were getting divorced, incorrect conclusion, or that their mom was pregnant, or that something was wrong with a grandparent. So these children weren't really spared from distress, but they were more confused and alone with their distress. So talking openly means that you're hearing what your child is thinking and can correct any misperceptions and can address their worries, whether real or imagined. Another reason to find a way to communicate honestly is that it helps children feel both included in what's happening and also prepared. So some children have talked about feeling kind of hurt or even angry after learning a parent has cancer belatedly, that somehow they weren't seen as important enough to deserve to be told sooner, and especially true when other family members knew before them. And talking about challenges helps children prepare for them with your support. And finally, I think a lot of us would say that we really value honesty, even when it's hard. We want our children to come to us when they're struggling or hurting, and when they've made mistakes, and when they know we'll be scared or mad at them. And especially for teenagers, having a parent who encourages them to talk about the good, the bad, and the ugly can be really protective. So talking honestly about cancer is our opportunity as parents to walk the walk, to show and not just tell kids that talking about hard things is really important to us. So that's some of the why of open communication, even when there's uncertainty. In terms of the how, there are some approaches that seem to help. To start a first-time conversation about cancer or to give an update, it can help first to check with children about what they've already been noticing recently. So you might ask a question like, I know I've had more doctor's appointments recently. Is there anything else you've noticed that you're wondering about? And this helps you know what definitely needs explaining and what your child, kind of already understands. And then you might share the updates. If you have a very new diagnosis, it might be that you've just learned you have breast cancer. It might include what parts of your body are affected, like, the scans I just had showed that the cancer has spread to my bones or spread to my liver. Changes in treatment plan are often worth sharing. This might just be saying that the medicine you were taking didn't work as well as everyone was hoping. So now your doctors are going to try a different medicine that you hope will work better to control the cancer. It's helpful to predict the most likely side effects so children are prepared for physical changes they might see and understand it's the treatment, not the cancer, causing some of those changes. And it helps children of all ages when you talk about any effects on their own lives and how you'll manage those together. I talk with parents about trying to use accurate language for what you do share. With young children especially, it's really tempting to use euphemisms like having a boo-boo on my breast or being sick or having a bump. But often those ways of describing cancer can leave children more confused. Having boo-boos and bumps, being sick, are all things that children experience too. So it's preferable to choose words that make it clear that cancer is different than illnesses they've had. And then check in about what your child has taken in from the conversation. You could say something like, that was a big chunk of information I just gave you. How would you talk to a friend about what I just told you? When you're facing uncertainty, like having to wait for test results or a new treatment plan, it's okay to say that, to admit what you don't know yet. You can acknowledge that uncertainty is really uncomfortable, and also give children a sense of when you think you'll know more, and let them know you'll be sure to update them when you do. It's also important to talk about emotions, both yours and your children's. Some children, may or may not be able or willing to share very much on this front. We talk about some kids being talkers and non-talkers. And it may not feel appropriate to talk about all of your own feelings, but naming some of what you're feeling, whether it's anxious about having to wait for more news, or sad about the progression of cancer, or grateful for family and friends, or all of the above, mixed together. Naming those feelings, again, helps in the showing rather than the telling your child that feelings are part of the whole picture and matter to you. And you want your child to know that you don't want him or her to ever worry alone, and to feel that you understand their feelings. After you have big update conversations, it's a good idea to follow up with each of your children individually. Ideally, sort of during their chatty times. A lot of times, kids are sort of predictable that way. For a lot, it's when they're in the car with you. For some, it's at bedtime. But let them know that you hope they'll share anything they hear about cancer from anyone else, so you can be sure they're getting accurate information, which of course doesn't always happen. For children who aren't big talkers or who may be sort of holding back to protect you from their worries, work together to figure out other adults who could check in with your child. If children have questions at any point, try to answer honestly. But it's okay to take your time first in figuring out what they're really asking. So for example, if a child asks you when your treatment will be over, is she wondering when your hair will grow back? Is she wondering if treatment will ever end? If you'll be able to go on vacation like you talked about? So sometimes just answering with, that's a great question. What got you wondering about that? Is sort of one way to open that up. I think that in any conversations where there's uncertainty kind of hovering around the edges, it's valuable also to just remind children of how they've successfully managed past challenging experiences and to convey your confidence that they can cope with difficult things and that you'll help them do it. So I want to finish up the communication section by talking about this really dreaded and difficult question, will you die? And of course, there isn't a right answer that fits every situation. And I know that addressing such a complicated question in a brief talk with, not having opportunity for individual follow-up, may leave some of you feeling really unsatisfied. And I debated whether to include it, but I'm including it because it comes up so often in my conversations with parents at all stages of illness. And I think it's helpful to hear how open communication might sound, even about the hardest topics. I think most parents intuitively are good at trying to blend honesty with hope. So some different ways this could sound for different situations are, my doctors and I feel very confident that this treatment will control my cancer. I'm not planning to die for a long, long, long time. Or, people can die from breast cancer, but there's a lot my doctors and I can do to try to control it, and I'm doing everything I possibly can. Or, medical treatments can't take the cancer all the way away. I'm working to live with the cancer as well as I can for as long as I can. Or, no one thinks I'm going to die this week or this month, but I am very sick and I'm trying to prepare. I'll let you know if it seems like I could die soon. Or, yes, the cancer's in so many places in my body that I probably can't live much longer. My focus now is just on enjoying every day as much as I can. We can't promise children that no one will ever die, although of course we wish we could. But we can look for ways to create zones of safety that will sort of allow children to relax those antennae for just some period of time. And even when that isn't really possible because time may be very short, it can really be a gift to children when parents are willing to talk about it and then support them as children begin to adjust to that possibility. So just to reorient here, we're talking about the factors that can tip the scale towards children's positive adjustment, even with adversity. And we've talked about warm parenting and open communication. And now I'd like to just touch on the other three factors, cohesion, control, and connections, before moving on to your questions. So what do I mean by cohesion? It's kind of the feeling that your family is bound together, that you're all part of the same team, even though there might be infighting among the players sometimes. I'll share two examples of things that seem to increase family cohesion. The first is kind of a no-brainer, just enjoyable family time or parent-child time. Sometimes cancer, though, makes it hard to have fun in the same ways that families have in the past, and COVID, of course, has made it even worse. If you have any reserves left at all, though, try to look for the small ways to take physical changes into account, but still have fun. So maybe you do something like Simon Says with a young child instead of kicking a soccer ball around. Maybe you create an obstacle course or challenge for them while you sit and cheer. Or, find a TV show to watch regularly with a teenager and create a ritual around it. Snacks, all kinds of snacks, a blanket, maybe even phones off. It's great for kids to be able to count on family time that's cancer-free. In other words, as normal as possible. And also, though, sometimes cancer-focused activities like doing a fundraising walk together or, shopping for a new headscarf are also really good ways to build cohesion. You might have already noticed that having a parent with cancer doesn't make kids automatically be thrilled about family time. They still will not always want to participate. And that can be frustrating and even painful for parents who maybe want to soak in just every possible minute they can with children. Some children feel that kind of intensity and need breaks from it. Sometimes they just crave time with friends. And sometimes it's kind of sad for them to notice changes in a parent. And so they may pull back a little to make it easier to compartmentalize. So you can try being curious about their reluctance, be clear that it's important to you that you all have family time and set things up that you think they'll like, but try not to say things that make children feel guilty. Another ingredient in family cohesion is the idea of family identity. So kind of what is your team about? What matters to you as a group? And there's interesting research on how children who hear family stories, so from earlier generations or from their parents' lives when they were younger, seem to adapt better to adversity. And family stories that follow what's called an oscillating narrative are especially helpful. So those are the stories that acknowledge that sometimes things were getting better and better for your family. People were more and better educated or doing better financially. And sometimes there were periods where things kind of fell apart or people made mistakes. But through it all, there were things that really mattered to our family. There were values we shared or strengths that we carried forward. I have a colleague at Mass General, Dr. Ann Fischel, who's a family therapist who's really passionate about improving the family dinner experience. And she's contributed conversation starters to a website that I'm going to share in the resources slide that I would really recommend for ideas about getting kids to talk around the dinner table. And so all of that can help with that feeling of being on the same team. So moving on and thinking about providing children with a sense of control, that feeling of being captain of your own ship, that can also increase resilience. And there are plenty of ways to do this, many more than what I've listed here, but here's a start. So having information can, of course, increase a person's sense of control. That's maybe a big part of why many of you are attending this conference today. Even when things are changing quickly or there's uncertainty, try to look for places where children can make choices about things that affect them. So, helping out at home may not be optional, but you could talk about whether your child would prefer helping out a few minutes every day or for a longer chunk of time, once or twice a week. Would they rather remember a set list of chores every week or agree that for 15 minutes a day, they'll be ready and willing to help with whatever you need at the moment? Stable routines also give many of us a sense of control and aren't just for little kids. So thinking about meals, bedtime, one-on-one time with each other. I know that COVID has upended so many of our routines, and I think, really we're all just doing the best we can to cobble together what we can. But I'll put in a plug for recreating routines that have fallen apart when it becomes possible. They can make life feel more predictable and can help children feel safer. Children can also gain a sense of control from being reminded of the successes they've had and the coping strategies that they've used in the past. So things like, the persevering to learn the times tables, working really hard at that, or having a wicked sense of humor, or a teenager's being willing to ask for help when he started failing chemistry. And finally, accepting that a lot is out of our control is actually part of the picture too. When you're dealing with an illness like metastatic breast cancer, it's really common to want to help your children grow up extra fast, to prepare them for everything that might be coming in the future. And unfortunately, it can lead to some tension and pressure in the relationship, because kids tend to resist these kinds of preparations. So it might help to remember that acorns need time to become trees, and children may feel more in control when they don't feel quite so rushed to mature. So finally, there are a variety of connections with other people that can help tip the scale towards better outcomes as well. You as parents may be looking for ways to get support, but not want to feel that every social interaction you have is focused on cancer. So having someone to organize people who want to help but maybe don't really know exactly what would be useful can be helpful. Our nickname for this is the captain of kindnesses. And you might also appoint a communications team, people who you'll update, who can then update other people in your network so you don't have to. For your children, try to build their connections with trustworthy adults, ones who know you well or who know your child well. Both offer different benefits. By doing this, you're letting your children know that it's not disloyal to attach to other people. You might also connect children to peers with shared experiences. Sometimes school guidance counselors will do a lunch bunch, for example. There's also a national organization called Camp Kesem that's dedicated to offering a summer camp experience to children who have a parent with cancer, and their website is included on the resources page. And last, I wanted to just touch briefly on professional support. I don't think that every child with a medically ill parent has to have a therapist, but some do. And some of the red flags that I'd look for include changes in a child's mood, behavior, or functioning for more than a couple of weeks, or for children who are already dealing with mental health challenges, a worsening of symptoms or a reemergence of symptoms. If a child asks to see a counselor, I think it's worth pursuing. Sometimes a child will do or say something that raises real concerns about safety. In this case, it'd be important to have an urgent evaluation, most often at a hospital emergency department, sometimes at your pediatrician's office. Referrals right now for therapy can be really hard to come by. I'm hearing from a lot of parents that it's just hard to find people with openings because I think of COVID. So if you are trying, it's just know that it's important to be persistent. Ask, from the very first call to be put on any wait lists that the practice may have, and try to use multiple sources to look for referrals, some of which I've listed here. So this has the list of resources that I mentioned, and it includes the MGH Pact website, which there's quite a bit of content on this website under multiple layers about child development. And one of the things I unfortunately wasn't able to include in the talk today was really any conversation about children's developmental stage and how all of that influences how you might support them. But the website has some of that information. Lots of Helping Hands is an online it has a calendar function, also a communication function. So for the Captain of Kindnesses, it's a tool that I think a lot of parents I've worked with have found pretty helpful. The Family Dinner Project is the website I mentioned that Anne Fischel has contributed conversation starters to. There's a book that the founding director of the PAC program, Paula Rausch, and another colleague, Nina Muriel, co-authored, Raising an Emotionally Healthy Child When a Parent is Sick, that has a lot of just sort of practical ideas about communication and supporting kids. And then I mentioned Camp Kesem, and Psychology Today has a Find a Therapist database where you can search for therapists by, I think, zip code, by, gender, by interests, or, areas of expertise that the therapist has. It includes a little picture and a bio of the person. So sometimes you feel like you have a better sense of the person than you might get just from an insurance panel listing. And then finally, just wrapping up, I'm just going to touch very briefly on this. Just a final slide about legacy leaving, again, because it comes up in a lot of my conversations, sometimes, after early in a diagnosis. So legacy just being the idea of, having gifts and letters for children that are enduring symbols of love. And this could really be its own talk, and I want to leave plenty of time for questions. But the slides in the slide deck, just as a way of making the idea feel more doable, making it feel talk aboutable. And I just would say that sometimes people envision projects like writing a memoir for their family that are just time consuming and sometimes really emotional and unlikely to ever be completed. So the slide just has some thoughts on paring it down, and happy to talk more if there are questions, but didn't want to spend tons of time on it if it sort of wasn't meeting what people were curious about. Great.
Yes, well, thank you so much, Dr. Moore. That was such an amazing and thorough presentation. We received so many different questions, and unfortunately with the limited of time, we won't be able to get to all of them, but they were amazing. And so here are just a couple of them. One was, what is an appropriate age to begin speaking to my child about my diagnosis?
So I think almost from infancy. I mean, I say that a little bit jokingly, but also kind of seriously. I think using the word cancer even for toddlers is not a bad idea, because they'll be hearing about it for a long time to come. And so you're making it clear kind of from the beginning that as it becomes part of their life, what it is that everybody's dealing with. So in terms of naming the illness, I think from very early on, it's often really helpful, most often really helpful. And of course, as children get older, they'll understand more about, medicines and treatments and that, all those elements of what it means to have a parent living with cancer. So of course, much of that will unfold as well with older children, but at least naming it, I think
Thank you so much. I agree. So another question we have is, how can I talk to my teenager to understand my diagnosis? Yeah.
So, teenagers are tricky, right? Because they're at a stage where their cognitive capacities are much more advanced. They can start thinking more abstractly about things. And yet at the same time, they don't always act in ways that feel like they're aligned with, what we think they know. So I remember a parent telling me years ago, she had a teenager who, she got home from the hospital, I think one time, and she found that the teenager had cleaned the entire house with Lysol, and it was amazing, had cleaned everything. And then, a week later, there were dishes all over this teenager's room, the living room. They were leaving junk everywhere again. So, the idea that what they understand and what they can do is not always aligned is one of the things to keep in mind. In terms of, how to help a teenager understand the diagnosis, I think maybe starting with making sure you have a clear understanding of what your child does understand already. So, it involves thinking about, well, what have you told them? What have other people told them in the family? What have they read? Checking about, have you looked online? Have you looked this up? What have you read? And that's an opportunity to make sure that, they don't have misinformation, because, kids now are better at Googling things than a lot of their parents are. And then I think talking about, asking what questions they may have. Some kids, will want to know and are just sort of looking for, permission to ask questions and looking for a parent to sort of express that they're comfortable talking. Some kids don't want to know and will kind of give that signal. And so deciding, all right, what are the headlines I need to share? What are the big picture chunks of information? Like, I'm going to need to start a new treatment soon. That medicine, that chemo that I had didn't didn't do what we wanted it to do. I'm going to have to go into the hospital, or, whatever the change coming up might be. I think of communication as sort of a bridge, like stepping stones over a bridge that you may know more than they do in some ways, but you're trying to sort of bring them along a step at a time. And so thinking about what are the pieces of information you can add to their understanding a bit at a time.
I love that. It's such a great visual as well, thinking about that bridge. And it's also so important to think about that from the big picture to the small picture. So those were two amazing visuals right there.
Yeah.
Another question we have is, do you have any additional suggestions for children with special needs? For example, children on the spectrum or have developmental disorders?
Yeah, that's a great question. Yeah, and something that comes up for us as well. So I think one thing is that I've learned over the years that parents who have children with special needs, autism or Down syndrome or anything, are usually the best advocates for their children. Of course, the best advocates of anyone. But so thinking about all the things that you've done over the years to sort of help your child, support them in thriving, drawing on all those skills is one thing that I want parents to think about from the get-go, that to know and have confidence in the idea that you already have, your child so well and you've gotten them through a lot. And that's an incredible toolbox to bring to the situation. So that's the first thing. I think some of the really specific kinds of advice or guidance comes from, really hearing about, a particular child, but kind of generally, thinking about the child's developmental age and then trying to tailor communication to that age. So it may often just mean more concrete communication than, a child who's maybe neurotypical might be able to take in and understand. A lot of kids seem to do well with social stories, and I've worked with parents a few times to try to make up our own. What's the issue that's currently a challenge? For one family, it was the idea that mom was throwing up frequently, was vomiting, and that was really upsetting to her young daughter on the autism spectrum. And it felt like, well, she must be like sick and maybe was contagious, and was the daughter going to get sick too? So making a social story about how the medicine she was getting was making her stomach upset, and so having a picture, having just a short sentence. I imagine many of you are familiar with social stories, but thinking, and if your children have teachers at school who are working with them, maybe they can help in creating something that would be useful.
Perfect. And that actually just segued to the next question that I had. So perfect, we're on point. Can you please provide some tips on what to share with educators so they can better gauge a child's behavior at school?
Yeah, great question. So one resource I'll just first point you to on the website, the mghpact.org website, there is a toolkit for educators that a colleague of mine kind of led, that you can download for free and share with school, that just talks about some ways for school systems to support parents with cancer. So that's first. I think it's most often pretty important that the school system know at least something about what your family is facing. And, there are always balancing acts between, privacy and, the parents wish for privacy. Sometimes the students wish for privacy. For younger kids, though, elementary school, I think it really is pretty important that their primary teacher does know. And I think just letting them know, kind of the basics. I'm having treatment for breast cancer. What it may look like for my child is there may be different people dropping them off or picking them up. There may be nights where homework isn't done to quite the level that we, would usually be hoping for. If you could give us, advance notice of any, projects that are going to require, 10 items from, Staples to be able to create. It would be great to have advance notice, that kind of thing, so that it feels more like a partnership. I think, for kids who are teenagers, there may be, less eagerness to have school know. Kids are very often sensitive about, not wanting to be different, not wanting to be treated differently. But I think even for teenagers, it's ideal to have at least one person at the school know. And you can talk to, I wouldn't probably do it without your child knowing, but figure out, who's at least one person we could tell. Maybe it's the guidance counselor, maybe it's the school nurse. And yep, we're not going to have everybody, checking in on you. Nobody's going to come to the door and say, Sally, how are you doing today? Like, we'll avoid that. But if something, something came up, you want to have somebody who's in the know. That's kind of the reason for younger kids too, that just having someone. I think the other thing that can be helpful with teachers for younger kids is really that idea of what does your child want? Does your child want someone to check in on them here and there? Would they sort of appreciate that attention, or do they not want to know? But if they were to get maybe teary for some reason in the class, is there a plan that's in place for them to, is there an escape route that you guys can develop along with the teacher and the student together? So those are, I think those are the kinds of things that I tend to try to think about with schools.
No, those are fantastic. Thank you so much. Definitely bridging that unit and making that team. They're so important. So you attested to that perfectly. Another question we have is, can you talk about how to handle the why did this happen to me? Why did that happen to you, Mom? Just the why question. What would be a good way for the parent to kind of be able to internalize that? And how would it be a good way to express that to a child?
Yeah, that's a tough one. So I think it partly depends on the child's age. And, I think when I think about, school age kids, a lot of their development is about figuring out what's fair and what's not fair. They're playing on the playground. Is the ball on the line? Is that in? Is that out? So the sense of what's fair and not fair is a big part of their consciousness. And so kind of teasing out with them what they think has caused the cancer can be a start in addressing that question. Do they have ideas about why? And sometimes they do, and sometimes the ideas are off base. Sometimes the ideas are involve something that they've done that we would absolutely want to know about, so that we can kind of correct that. Sometimes kids feel, young kids, preschoolers feel like something they did physically, or some time that they were really mad at a parent and felt angry and wished something bad might happen to them, and then something did. They can feel to blame. So we want to know if that has come up. With one kid, I remember talked about, he was wrestling. This is with his dad, who was sick, but I think kicked him in the stomach by accident. And later his dad was diagnosed with gastric cancer, and he felt like he had caused that. So checking in about that. With school age kids, it tends not to be quite that concrete, but it may be about stress and the idea that we learn at pretty early ages now that stress causes illness. And I think a lot of us, feel that way ourselves and talk about, our bodies needing to calm down in order to heal. But, kids are well aware that they can cause stress in our lives as parents. And so as a result can also feel responsible for making, parents sicker. So that's another thing we really want to be careful to talk about with them. So that's sort of some of the reasons about, what does the child think about why? When I heard the question, though, I thought, well, it's sort of a bigger existential question as well, and I think that's part of the work of having cancer, right? Part of figuring out, how do I make meaning of this? How do I understand this? And that comes from, all of our values, our religious traditions, our beliefs. I think making it clear that it's not deserved, that, whether, no matter what anyone did or didn't do, nothing I deserved. It's kind of bad luck, is one of the ways I talked about it with parents. It's like rolling a dice. It's bad luck. People don't always get what they deserve. So that's a part of it. But I think when kids are asking that, it's often, it can be, they may be asking for a different reason than we as adults ask the question. It can be more concrete, and so exploring that first can be helpful.
Thank you so much. I know that's such a difficult question, and you answered it perfectly. Thank you. From the caregiver's end, how would it be a good way to know from the caregiver standpoint what is something important as a caregiver or a partner I can do to assist with the children, with the partner that's sick? Any points on that you'd like to touch on?
Well, I love that someone's asking that, first of all. Just asking that question, I think, is hugely helpful, supportive, and probably asking your partner that. I think one of the things a co-parent can do uniquely is to, monitor both yourself, as the co-parent, and then also the person with cancer. Keep checking in about depression, anxiety, mental health concerns, and encourage treatment. And as I said, that really is a risk factor for children not adjusting so well, to have parents with untreated depression and anxiety over a period of time. So I think that's an important role that the co-parent can have. And then I think, it's finding ways to work as a team, finding ways, I think it's hard because it's a constant adjustment, and finding ways to respect all the capacities that a person with cancer continues to have, and all the ways that they can be a parent as they've always been, while also at the same time figuring out how to fill in some of the gaps that may be coming up a little bit. I think it requires a lot of communication, a lot of talking, a lot of being able to even tolerate some emotion here and there, which isn't always easy. But I guess that's what comes to mind first. I think probably good communication is maybe the best sum up of that.
I completely agree. And I love that that question was asked as well. It's because being a caregiver, that's a tough role, definitely a tough role.
Really,
for the next question, can you touch upon the guilt that we may have as parents, such as not having the right energy anymore, having to be more delicate with our body so that way it doesn't metastasize further with broken bones? What would be some good points you could talk about with that?
Yep. Parental guilt is, it's real. And I mean, yes, I don't have a quick, easy answer other than to say, I think the idea of self-compassion maybe is the best antidote I can think of with guilt. Reminding ourselves that this wasn't a choice we made. This is, it's not something we're doing to our children, which is something I hear a lot. The idea that, we're doing, darn well the best we can. And sort of treating ourselves as we would treat a friend, with, compassion, with a sense that this is really painful sometimes to feel as though I can't be the parent that I really, expected to always be, that I want to be. It's challenging to sort of just sit with that for a little bit of time, and to be kind to ourselves as we are feeling that way, without then getting so wrapped up in it that we can't reconnect with kids who are there with us in the moment. I think it's also complicated. Sometimes kids will say things that kind of increase that feeling of guilt, and there's, for lots of reasons. And so that, and I think parents without cancer will recognize that too. They can, find lots of ways of kind of getting what they want sometimes. That's just being kids. So, some of that is normal kid development and would maybe be part of the relationship, whether or not cancer was part of things. So kind of keeping that in mind too. But I think finding friends to talk through that with, finding someone you trust who can help talk you through that. It's sometimes hard to get out of that spiral just on your own.
I agree. Thank you. And you're talking us all through it as well. So we greatly appreciate your advice as well. It's very appropriate and appreciated. So another question we have is, if a child has not yet talked about death, when would you think would be an appropriate time to bridge the subject, and how would you bridge the subject?
Yeah. It's a tricky question because it's I think it's so context dependent. And so some of the factors that, you want to think about are, well, how old is the child? How much does the child already know about the illness? Is this a child who's, been kind of aware of things all along? Or is this a child who's really had very little knowledge of any of the treatments, or even maybe has not even known what the illness specifically was for a long time? And sort of what does prognosis look like? So there's, a lot of factors that go in. So it makes it hard to give a really specific, satisfying answer, which I like to try to work out with parents, but in this setting just can't. I guess the thing I can say is that, for the younger the child, I think the closer to an anticipated death, is it appropriate to talk about it. So, younger kids, it may just be a day or a couple of days, right? Or as things are unfolding that really signal a very clear change. With older children, older school-age kids or adolescents, I think having more time, having a sense with some time to prepare and to understand can be pretty helpful. I think that's about as specific as I can get without, yeah.
No, that you hit the nail on the head. That was perfect. I know it's a difficult conversation to have for all of us. And thank you for so many of the tips and strategies that you provided us with all of these questions today. We as parents living with this diagnosis, we take it very seriously. So you have given us so many tools to add to our toolkit. Thank you.
I'm so glad.
And with that, making sure we're being respectful. Thank you. And being respectful of everyone's time. I wanted to definitely thank you so much, Dr. Moore, for your informative presentation. It just really means so much to each and every one of us. And thank you so much to everyone that joined us. It's an honor. And we as parents, we appreciate everything. So thank you so much. Please definitely make sure that you join us 3:15 to 4:15 Eastern Standard Time for our next keynote, Thriving Through Food. So make sure you get up, stretch those legs, grab a healthy snack, and looking forward to seeing you all very soon.